So it's really important after any surgery not to just work the muscles around the specific joint, but those above and below as well. So you can get muscle wasted. When you've had any form of surgery and your muscles haven't been working, they can get quite weak. So the best two for you to link to the knee are inner thigh squeezes and glute squeezes. So we're going to use a soft ball if you have one, otherwise a folded up pillow is absolutely fine. Sitting yourself with your back supported, the ball is in between the knees. From there, pulling those stomach muscles in, the deep transverse muscles that we've gone through before, and you're going to squeeze in a 10-second hold, really pushing in nice and tight and making sure that here is doing the work rather than here, okay? And ease off. And you're going to squeeze again. And ease off. Perfect. You're going to attempt to do 10 of those, guys. So like the other exercise, 10 with the hold. So as well as working into the inner thighs, we're also going to be working the bottom muscles because they're so important for supporting the hip area, which is what the knees are reliant on. So really simple exercise, rather difficult to demonstrate, but what you're going to be doing is clenching the bottom muscles together, really squeezing for a 10-second hold. So you want to visually and physically feel those bottom muscles squeeze together, clench together, 10-second hold, and relax off, okay? So clenching together, 10-second hold, relaxing this part of your body, only working down here and the stomach, and relaxing off. Once more, clenching together, really, really holding that nice and tight. Bottom muscles are going as hard as they possibly can, and relaxing off. And you're going to repeat that 10 times, 10 seconds each exercise.